Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Tuesday, November the 30th for British Columbia. Honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Honored to be here on their lands today. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. Today, of course, I want to share our latest updates on our COVID-19 public health response and our vaccine program. As I'm sure everybody is aware, in the last few days there have been many questions about the most recent variant of concern, the Omicron variant that was detected first in South Africa and has now been detected in many countries around the world. And as you know, we have been looking here in BC as well. And today we have identified our first case in BC in a person in the Fraser Health Authority who recently traveled and returned from Nigeria. They are isolating, and public health is, as we do with every case, following up with them and their contacts at this time. To date, the Public Health Agency of Canada, who we've been working closely with since late last week when this was first identified, has identified 204 people in BC who were recently in affected areas. And the quarantine service, working with our teams, have connected with all of these individuals over the past few days, and they have been sent for PCR testing and are in isolation. We have a robust program here in BC and have had from the very beginning, using whole genome sequencing to help us understand what strains are transmitting to whom. We've been using them for helping us identify transmission in outbreaks. And as you know, over the last number of months, we've done a very comprehensive program. We did 100% of all of our cases for a period of time. And as those cases increased, we targeted our program to make sure that we did whole genome sequencing on 100% of cases for 1 week a month, and then a proportion for every other week. Plus, from the beginning, we have been doing a whole genome sequencing on any positive COVID test from anybody who's traveled internationally, and that is how we detected our first case today. We are going to be continuing doing whole genome sequencing on 100% of our clinical samples, as we have been doing. And I will say as well that we did, especially when this new variant became known, we did look back at all of the whole genome sequences that we have. And this process helps us understand how the virus has evolved. And we can be confident that we're not seeing widespread transmission of this variant in BC yet. We know that that these concerning mutations can arise, and where vaccination is low in parts of the world, they can spread rapidly. It reminds us as well that this new variant of concern reminds us that we are in a global storm and that it is not equal everywhere around the world. And equal access to vaccination is something that's going to be important for us to get through this. So there is still a lot we do not yet know about the Omicron variant, and it will take some weeks for us to get sufficient data to understand. And this will entail careful surveillance, which is one of the things that we're doing in Canada and here in BC, and enhanced whole genome sequencing, as I've mentioned, and epidemiologic studies to help us understand who is being infected, whether it's causing more severe disease. These are the things, the data that we need to understand if this virus is going to be, this strain of the virus is going to be more transmittable than the ones that we've seen so far. There are some suggestions that it might be. But whether it will outcompete the Delta variants that we've seen so far here in BC is yet to be known. So that's, of course, the AY25, 27, and a smattering of the 4.2. Whether it causes more severe illness is something that is also still unknown. And whether vaccines are less effective or people are more likely to be reinfected after being infected with a Delta strain, for example. These are the questions that we will be working with colleagues across the country and around the world to help answer for everyone. In the meantime, the Government of Canada acted quickly to put in restrictions on travel to try and slow down the introduction. As we have seen with every single variant that has arisen, we cannot stop this virus from transmitting, but what we can try and do is slow it down to help us understand exactly where the virus is now, where this variant of concern is, and that's one of the things we've been doing. I call it case finding right now, to have an understanding of where it is. But it also means that we need to take cautious and prudent action as we go through this next few weeks. Here in BC, we are fortunate that we already have many protective measures in place, but we must anticipate and plan for the worst, even as we hope that this strain will not cause the havoc that we've seen with some others. Tried and true public health measures work. We have seen this repeatedly over the last 2 years. We know that, and we know that they work against all the variants. First and foremost is vaccination. And yes, while vaccination doesn't prevent 100% of infections, we have seen how important it is on protecting people from more severe illness, particularly with the Delta variant. We've seen the strain on our healthcare system when we've had even small outbreaks in groups of people who don't have that protection from vaccination. And we are thankful that we have vaccination to help us weather the strain from the Delta. But we also know that masking, especially when we're in indoor crowded spaces, physical distancing, limiting our gathering sizes, especially when they're indoors, and good ventilation are things that make a difference in helping prevent the spread of this virus. Those things are the same. And in the excitement of the holiday season that's coming up, and with our ability to enjoy so many activities that we have here in BC that had been restricted for many months, let's not forget that we are not yet over this pandemic. We live in a global community, and we are all affected by what happens elsewhere, just as others are affected by what happens here. So these border restrictions that we have in place, and I know there's some new measures being announced today, but until everybody in the global community has the ability to be vaccinated and has the same protections we do, we are all still at risk. As I said, the best thing we can do is to protect ourselves and our loved ones and our communities by getting the protection that vaccines offer. And we now have that added protection that, as of yesterday here in BC, children 5 to 11 years of age are also able to be protected with the pediatric vaccines. We wanted to ensure that every parent had access, and as you can imagine, here in BC in particular, it takes some days for the shipments to come from Ontario to us, and then for us to be able to distribute them. And I just want to give thanks and kudos to our teams across the province. There have been extreme measures to try and overcome some of the geographic barriers that we have had because of floods, because of roads being disrupted, because of supply chains being disrupted. And it has been a Herculean effort, literally, when that some of our vaccines were actually flown by Hercules, and thanks to our partners to help us get those to places across the province. I had the wonderful opportunity to be at an immunization clinic yesterday in Victoria, and there was excitement in the room and relief. Relief on the faces of parents, and a little bit of anxiety and relief on the faces of children once their vaccines were got. And to all of those children who got their vaccines yesterday and today and will be getting them in the weeks ahead, I just want to say you are all brave and vaccine heroes. And parents, now's the time to learn more about the pediatric vaccines and to get your children registered. And yes, you will get an invite, and they will be eligible in the next little while. I do want to remind parents and everybody that pharmacies are coming online to help particularly with the booster doses. And right now, they only have the vaccines that are for children 12 and older. So you cannot get the pediatric vaccines out at the pharmacies at this point. And soon, though, we will have more pharmacies online across the province to support our booster campaign. I also want to put a call out to the many recently retired doctors and nurses and other healthcare providers and other immunizers who stepped up when this vaccination campaign started about a year ago. We need you back now. We can use you in our clinics across the province. We've been stretched, as you know, in our healthcare system, and we could really use the support of immunizers. So I encourage you, if you have some time, to connect again with the health authorities and to come back and be part of our wonderful vaccine program again. Given the heightened concern with this Omicron variant of concern, I would like to remind everyone about the importance of using all of our layers of protection as we head into winter and into the high days and holidays ahead. This includes washing your hands regularly, keeping our groups small, choosing outside instead of inside, and staying home and away from others if you're sick. Having vaccinated people only, particularly if it's an inside gathering, or if you have elders or seniors or people whose immune systems are compromised. We need to protect them through this highest risk transmission season. I also want to clarify the provincial health order on masks. It requires everyone 5 years of age and older to wear a mask in all indoor public spaces. This will become more and more important, and we've seen that around the world as people are dealing with this new potentially increased transmissible variant. It's an important measure that we all need to adhere to here in BC. And as we enter this holiday and winter season, I am amending the mask order to include a requirement that participants attending worship services, including choirs, must wear a face covering, a mask, during services. These masks can be removed for eating or drinking to allow for ceremony activities, and readers and celebrants can remove them if distancing is in place during the celebration of the ceremony. As well, I am adding to our events and gathering orders a requirement that worship services must be limited to 50% of seated capacity unless all of the participants are vaccinated, in which case full capacity or 100% can be used. The province, as you know, has a proof of vaccine card available for faith services to use, but will allow flexibility for you and your congregations to work with congregants to provide proof of vaccination by other means. And I know that many faith services have done this already, and many faith leaders are working with their own communities to make sure that we have these measures in place to protect people over this period of time. As well, I want to update people on the additional restrictions that have been in place in interior health, and with the decrease in transmission and the leveling off of our hospitalizations and the strains in communities, the additional measures in place in interior health will be repealed as of tonight, and the current restrictions that are in place, both the mask mandates and the gathering and events orders that are in the rest of the province, will apply to all of interior health. So that means that you can have 100% capacity when the vaccine card is being used, for example. In addition, the northern health restrictions, the Chief Medical Health Officer in the north has reviewed the restrictions that are in place there, and we've been in a transition period, as I've mentioned, over the last week and a bit, to try and ensure that we are having restrictions that are commensurate with the risk in those areas, as well as the strain on the healthcare system. And so Northern Health will be revising their orders, one to have an expiry date of January 31st of 2022. The order will cover all of Northern Health Authority. It will include that bars and nightclubs remain closed. Restaurants must continue to end their liquor service at 10 p.m. Given the situation in the north, there is still no in-person worship services being allowed at this time, although drive-in services will be permitted. Social gatherings at private residences will be for up to 10 people inside or 25 people outside if people are fully vaccinated. Outdoor events with more than 25 people will have a 50% capacity with use of the BC vaccine card, and indoor seated events with greater than 10 people will have a 50% capacity limit, and that includes funerals, weddings, sporting events, theatre, arts and performance events. And I know some of these were restricted to a much lower number in the past, so these changes will come into effect starting tomorrow as well, with the use of the BC vaccine card. In addition, the restrictions that are in place in the Fraser East region will remain the same. We know there are many things that people are dealing with in Fraser East right now. So this is a lot for us to think about today. I think we are reminded that we're not out of the woods yet with this pandemic, and we are in a most difficult and challenging time. And people in British Columbia, across our province, have been tested repeatedly, not only by the pandemic, but also by nature, as we continue to see today with the ongoing rain and flooding risks. The days are darker and colder and shorter, and we're spending more time indoors, where this virus continues to spread more easily. At the same time, our risks remain high globally as we see transmission in countries that don't have access to vaccination, where variants of concern like Delta and now Omicron emerge. Despite this, we see every day the strength and resiliency of our communities across BC, and we persevere. And there are rays of hope. We know now that being able to protect our younger children is a really positive thing for families across the province. And we've seen the support and heroism from our neighbours, from our first responders, and from our healthcare workers. And you have my gratitude. We also know the more people who are immunized, no matter what age, the safer we all are. And it's one less thing for us to worry about as we get through this challenging time together. We will get through this storm, this many storms together, and we need to do that by continuing to have that compassion and kindness for each other and doing all of the things that we know will keep us safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by saying that I'll be providing a number of updates, some of them shorter than usual today, because there is, of course, a significant number of questions that may come from what I'm saying, what Dr. Henry's saying, so we want to give you some time for that. I do want to say that a year ago, the independent review of BC Healthcare, led by Dr. Mary Ellen Turpel-Lafont, was released. In plain sight, addressing Indigenous-specific racism in BC, BC Healthcare confirmed widespread Indigenous-specific racism, stereotyping, and discrimination within the healthcare system in BC. We will be responding to this in more detail later today, including efforts to address the recommendations in her report and to create a culturally safe healthcare system for all, including where we're making progress and where there's more work to do. I understand Mary Ellen Turpel-Lafont will be releasing her own response as well, and that should come at approximately 3 o'clock. I can also report to you today on the vaccination rates within the BC Public Service. As you know, vaccination is a term of employment within the public service at this time, adding another layer of protection for government workers and the people they serve. The vast majority of public servants, like the vast majority of British Columbians, are fully vaccinated. As of today, more than 98% of BC's public service employees are partially or fully vaccinated, and 97% are fully vaccinated. A small number of people will have legitimate reasons why they do not get vaccinated based on a medical or other condition. And we have received a small number of accommodation requests. It's 0.72% of the workforce. Those are being reviewed on a case-by-case basis. I want to thank the members of the public service who have been vaccinated in such massive numbers for all they're doing to protect themselves, their coworkers, and the people around them from COVID-19. I also want to note with respect to vaccination that we're at 4,212,517 first doses, 4,056,228 second doses, 419,163 third or booster doses. I just want to put that in context because people will often think back 6 months ago or think back to when they got their first dose. But about 6 months ago, about at the end of May, we saw approximately 200,000 second doses. So the work on third and booster doses is significant and positive. Further, I know that there's interest in registrations and booking of children 5 to 11. 114,106 children 5 to 11 have been registered in BC for their vaccination. And as of 11 o'clock today, 41,697 have booked their appointments. So I appreciate the progress that's been made and certainly ready to answer questions on that subject. Next, I just want to note that the federal government made an announcement at 1 o'clock, which all of you will, I think, be interested in. They announced they're adding Nigeria, Egypt, and Malawi to the list of countries involved in the temporary travel ban to the list that was announced last Friday. And also, the federal government announced that they'll be requiring all air arrivals except from the United States to have arrival tests and self-isolate while waiting for results. We understand the federal government will be providing kits to individual travelers on arrival and have or are contracting with a number of providers to provide the tests and deliver the results to individuals. And obviously, we're assuming that the protocols will be in place, and I expect they will, to keep provincial public health informed of any positive results. We'll be meeting with the federal government. Indeed, there's a meeting at 2:30 at the end of this press conference to discuss the details and the challenges of implementing this measure. But I want to say this. We're supportive of the federal government taking precautionary steps until we better understand the potential risks of the variant, as Dr. Henry has said, in the coming weeks, and we'll work with them diligently as we have from the beginning of the pandemic as they roll out these new measures. I want to note one of the key elements of what BC has done that is, I think, distinctive and important is the investment that we've made in contact tracing. I want to note that there are a total of 1,661 contact tracers in BC. We were working on contact tracing as of November 26, 2021. Also a very challenging time for our healthcare system. I just want to note we be up to date on capacity and the number of people using our healthcare system. Just to say that we have, as you know, 9,229 base beds in BC. We have 2,353 surge beds in our province. And as of today, we have just over, I think it's 9,302 people who are inpatients in BC hospitals. In critical care, we have 510 base critical care beds, 218 surge critical care beds, and the number of those in critical care in total is 489. And as noted, and for people in the north, this will continue to be of interest. 144 critical care patients have been air transferred out of Northern Health. 113 of those have confirmed to have COVID-19. And finally, with respect to surgeries, you'll note that from November 21st to November 27th, health authorities postponed 230 non-urgent scheduled surgeries. That's 16 in Fraser Health, 17 in Northern Health, 4 in Vancouver Coastal Health, 25 in Vancouver Island Health, and 168 in Interior Health. No surgeries were postponed in the Provincial Health Services Authority. Cumulatively, from September 5th to November 27th, there have been 3,451 surgical postponements. But I want to say an enormous amount of surgery is also taking place in the province, certainly parallel to what's happened in previous years and pre-pandemic times. In the most recent week for which we have statistics, October 31st to November 6th, 6,918 surgeries were completed in BC. And obviously, all of this brings great relief to those needing surgery and to their families and reflects the extraordinary work that it continues to take place across our system. I think surgical renewal obviously means the most to those in need of surgeries and to the family and friends and families who love and support them. But I believe it's also a statement of resilience by our extraordinary healthcare teams around the province, by communities, what we need to continue to do in our healthcare system while dealing with the challenges of 2 public health emergencies and other extraordinary challenges that we're dealing with, such as the implementation of the In Plain Sight report. No matter the moment being faced in our BC pandemic, those who deliver surgeries to those who need them show us achievement that adds to our appreciation of welcome moments and lessens the weight of those that challenge us. It simply does. It is, I think, an example in which we can all find strength in our own resilience, no matter what moments we're facing in our BC pandemic. With that, thank you very much, and we're happy to take your questions.
Thank you for joining us today. As a reminder to the reporters on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. Please also remember to take your phone off mute, as you are not audible until your name is called. Our first question is from Binder Sajan, CTV.
Hi, it's actually Binder Sajan. Just wanted to ask, with 3 more countries added to the federal list of banned flights, do you have an idea of how many more people might be in BC and need to be tested or isolated? And just can you give us a sense of, Dr. Henry, like how likely is it that we will have more cases with this variant and how concerned the public should be?
Yeah, I think this is the level of concern is at watchful level. It is something that we are paying attention to. We're doing additional enhanced surveillance. So I mentioned we do whole genome sequencing of any positive international traveler, and that's how we identified the person who was positive today. And there's a program as well nationally to do random testing of vaccinated travelers, and that's how the people were identified in Ontario. And in both these cases, these are people who were traveling to a country that was not initially identified as having transmission. So these are all things that we're learning over time. We don't yet know how many additional people will be returning travelers to BC from the additional 3 countries, so Egypt, Malawi, and Nigeria. But we have also been looking at all of the travel-related cases that we have, and so we have not seen a lot of it. We can be confident with the rapid whole genome sequencing that we've been doing that it's not widespread in BC right now. What we are seeing is 99.6, I think it is, % of our cases are the the Delta strains that are AY25, 27, and a smattering of 4.2. So we have gone back and looked at that, but having said that, we will continue to watch. So it is inevitable, I believe, that we will see more cases, but what we're not seeing is widespread transmission right now, and that's where the uncertainty lies. Does this strain have a competitive advantage that means it will take over the strains that are circulating now, as Delta did from Alpha and Beta? And remember earlier on for us, we had the Alpha and Gamma that were competing with each other, and then eventually both of them were overtaken by Delta. So those are the things that we'll be watching really carefully over the next few weeks.
Binder, do you have a follow-up?
Hi. Yes, I do. I have one for a colleague. So nearly 12% of people in British Columbia who died from COVID likely contracted the virus in hospital, according to Ministry of Health statistics. Acute care outbreaks continue despite your guidelines on how to prevent them. Why are there so many, and what more will you do to prevent them, especially in this phase of the pandemic with Omicron?
Yeah, well, I think it's very clear that acute care outbreaks can spread quite rapidly. And part of that is patients who are coming in from the community who have undetected disease, and then it's detected after it's spread within the hospital system. And just today, the hospital outbreak at Abbotsford was declared over, thankfully. And so we've been doing a number of things. I think if we look at the number of people who have what we call nosocomial or hospital-acquired COVID infection, it's a very small percentage of the overall number of people that have had COVID, and it's heavily weighted to earlier on when we didn't have as robust screening and we didn't have the vaccination. So we have continued to have smaller, much more contained outbreaks in the last few months, and there are a couple of things that have made a huge difference. One is the fact that all healthcare workers now are vaccinated, and that means the protection that they have and the protection that they have from patients who may be bringing COVID in with them, and the very high vaccination rates that we're seeing in our communities. And also, more recently, we've seen the effect of the booster doses. The people who were getting breakthrough hospitalization were generally older people with more compromised immune systems. So this booster dose has made a difference in that as well. So that is not the only thing. The other important things, of course, are paying attention to personal protective equipment. That's why we do require people to wear masks at all times in the hospital, both healthcare workers and visitors. The fact that visitors need to be vaccinated to come into our hospitals because we recognize how challenging it can be, particularly in some of the wards. As well as there's been a lot of attention paid to appropriate infection prevention and control precautions, including ventilation in particularly some of the older facilities. So it is a combination of infection and prevention and control measures on the increased vaccination, on the healthcare worker vaccination policy, and the vaccination that everybody is getting in the community.
Just one short thing to add, Binder. We have today, as of today, 4 acute care outbreaks in BC. I think maybe 3 after Abbotsford. 2 long-term care outbreaks active in BC, and 1 in assisted living. The 2 long-term care ones are at George Derby, at Peace Villa, and then 1 at Laurier and Prince George. And you see the effect of mandatory vaccination here. Compared to where we were before. In the end of October, we had approximately 20 long-term care outbreaks, 6 acute care outbreaks, 3 acute assisted living outbreaks. So the impact of the measures that have been taken, both mandatory vaccination, booster doses, and the efforts that have been made with respect to visitors have had a real effect. In long-term care, of course, just about all of the residents are vaccinated, the vast majority now 3 times. Staff have all been vaccinated 100%, and visitors are all vaccinated. It's slightly different in acute care because, of course, a disproportionate number of new patients related to COVID-19 are coming into the hospital and vaccinated to get the care that they need. But that said, the steps are effective, and what we're seeing is, especially in long-term care, and nobody, I can tell you, is more grateful for this than me, but than anybody who knows anybody in long-term care, to see that we're down to a small number of long-term care outbreaks. And obviously it continues to be a concern at George Derby and Peace Villa, but you can see the progress that's been made in part related to these measures.
Our next question is from Richard Zussman, Global News.
Dr. Henry, the federal government, as part of their announcement they made today, says they've asked NACI to look at new guidance around boosters. What could this mean for British Columbia in terms of our booster program? Do you think that there should be changes made to boosters considering the new variant? And, what's your guidance as we head to the holiday season? Should families download the BC Vaccine app and require their guests to show proof of immunization before showing up for a holiday gathering?
Ooh, that's a toughie. Remind me about that one. Okay, so the first part around the National Advisory Committee on Immunization, we at the Council of Chief Medical Officers of Health have been meeting with them regularly, and they came out with recommendations, and they've been doing it in pieces. So they've been looking at first they looked at people who are immune compromised and whether they needed a 3rd dose to give them adequate protection from the primary series, and then they looked at who was most at risk and needed booster doses to start with. So what they have been looking at over the past number of weeks, and what we expect to have discussions with them later on this week, is the general population. So people who are immune competent and younger and not necessarily at higher risk. As you know, here in BC, we have already made a decision around everybody 18 years of age, actually 12 years of age and older, though booster doses aren't yet approved by Health Canada for younger ages. But anyway, we've also already made a plan for our booster dose approach, which essentially focuses right now on those at highest risk, so healthcare workers as well as people over the age of 70, where we're trying to focus on making sure they get them. Because we started early with that group of people, we know that they're the ones having the most breakthrough, as well as they often had the shorter interval. So we'll get some more details from NACI later this week, but I believe that that they're likely to we'll look at them for advice around intervals and whether there is any need to change an interval. Right now, we're looking at 6 months for most people, and the vaccine effectiveness data that we have from BC, from Quebec, really supports that. So I don't think it'll change, but everything is new. We are looking at the information that's coming around Omicron, and as I mentioned, it really is a bit too early to say, but within the next couple of weeks we'll have more information on that. And I know I've been watching the UK has made a decision to move up booster doses for younger people, so it will be a discussion that we'll be having in the coming days, and more information by next week on that. In terms of whether you should use the BC vaccine card, it is something that is there to help you. And I think many of us trust our family, especially if we're having people over. And I know many people have recounted to me that it is challenging sometimes when you have family or friends who may or may not be vaccinated and you might not know. So what I encourage everybody to do is to have those conversations. It is important for people, especially at this time of the year, to continue to take these precautions to protect those who are most at risk. So if we're having family gatherings and we have people in our family who are elder, who are seniors, who have immune compromising conditions, or we're concerned about catching this virus, we know it is here with us. It's going to be here with us for a long time, and vaccination is our best protection for those who are most vulnerable. So I think it is important for us to kindly have those conversations, and for people who have chosen not to be vaccinated at this point, I encourage you to rethink that decision and to have those conversations about not putting others at risk if you do make that choice over this coming risky period.
Richard, do you have a follow-up?
I do. The World Health Organization has come out with some guidance around travel restrictions, ultimately saying that these sort of blanket travel bans don't really work. They're also suggesting anyone over the age of 60 or with immuno issues should not be traveling internationally right now. Is this the sort of guidance you would give to British Columbians around travel, considering the variant?
Yeah, this is a toughie. And I think this variant in particular, we had been moving towards a relatively good place. But it reminds us that any time that the virus can change and transmit between large numbers of people or animals in some cases, that it can mutate and change very rapidly. And just by chance, at some point, you're going to end up with a combination of mutations that can make it a variant of concern. And we know that vaccination is highly effective. But right now, the access to vaccination and therefore the rates of transmission of this virus in different countries around the world is different. And yes, we're seeing rapid rise in cases in some countries in Europe. We're seeing it in parts of Africa, South Africa right now. We're seeing it in Southeast Asia. So I think we need to understand this virus is everywhere. And if you're not, we're all all likely to be exposed to it, more likely if you're traveling to a country where transmission is going up. And if you're not protected through vaccination and you're older or your immune system is not working as well and you may not get as much protection from vaccination, you need to understand your own personal risks when you travel. So I do think it's a reminder to us that things can change very rapidly during this pandemic, and people have been stranded. We know there's healthcare workers who've been stranded. There's our national field hockey team is stranded down in South Africa. So these are all the trials and tribulations of travel right now internationally. So that is a personal risk that people need to take or make. But I think the advice about your own personal health risk is an important one to consider as well.
Our next question is from Lisa Cordasco, Vancouver Sun.
Hello, good afternoon. Given the Omicron variant, will you apply the precautionary principle at the Whistler Blackcomb Ski Hill to order proof of vaccine in order to ride the gondolas, as many have been urging? And if not, why not?
As with many specific things in specific businesses, I think that's not my role. My role is to provide different businesses and how to do their business safely. And I would encourage people who ski at Whistler to make their views known to Vail, who makes those decisions. I will remind people that you need to be vaccinated to travel. You need to be vaccinated to go into any of the restaurants. The BC vaccine card applies in many of those places. The masking mandate applies, and that is enforceable at places like ski hills as well.
Lisa, do you have a follow-up?
Yes, thank you for that, Dr. Henry. For a colleague, wondering how likely is it that we will see crowd restrictions at sporting events and large games if the new variant is more transmissible?
Yeah, so those are the things that we need to balance amongst the other measures that we're taking to mitigate risk. So we know now to go to events, indoor events, anywhere in the province, you need to show proof of vaccination. And right now that means you need to have fully vaccinated. And so that is one of the important ways we mitigate risk. The other important thing, of course, is the other things that I've been talking about all along. If you have gone to a country where there's increased transmission, if you've been exposed to somebody, if you're feeling unwell yourself, you need to stay away from these places, and we need to make sure that we take all of those precautions that keep us from passing this on to others as well. But right now, I believe that with the masking mandate that we have in place, with the BC vaccine card, and with the high rates of immunization that we have, excuse me, the measures that we have in place with the gathering and events order should be sufficient to get us through this winter and this holiday season. Excuse me. I will say that is one of the reasons why I've added on the faith-based gatherings. Just knowing that risk is increasing as we're gathering indoors, that we tend to go to more faith-based gatherings over these holiday seasons, and making sure that we are doing additional things to make sure we're protected in those situations as well.
Our next question is from Lisa Yozda, City News.
Hi, thanks, Lisa Yuzda. Dr. Henry, when you're talking about people making these decisions about whether they're to travel or not, it feels like we're back at March 2020, and a lot of people do have plans to go different places over the holidays. When will people really know it's time to make that tough decision?
I encourage people right now to think about this. We're in a time where we are seeing this virus transmit in many countries around the world. They are taking additional measures, sometimes very quickly. We look at France, we look at Germany, Austria, Singapore, Japan. So you need to really take a step back and realize that we are not through this yet. We're not through this pandemic, and the situation is changing very rapidly. And it may be that this virus, the Omicron strain, will turn out to be one that doesn't outcompete Delta. But Delta's bad enough right now, and it is causing strain on healthcare systems in many countries around the world. It caused strain on our healthcare system here. So these are the times when my recommendation is to think about staying close to home, staying close to your family, having your gatherings small. Having said that, I know that there are many important reasons why people may need to travel, whether it's to spend time with loved ones, whether there's essential travel that people have to do. So those are all of the things that we all need to balance right now. I think if you're vaccinated and fully vaccinated, it puts the risk in a different perspective. But you need to understand that in the countries you are going to, there may still be rapid implementation of restrictions. There are testing requirements that are going to be changing. I know in many countries in Europe, there's still a lot of testing that's required, and that is also a financial cost. That's the situation we're in right now. Here in BC, we've also been through an awful lot in these last few months. So I know sometimes that means people need to be with family, but I would encourage you to keep it small and keep it close to home.
Lisa, do you have a follow-up?
I sure do. With the new border restrictions that the federal government has brought in, it's very noticeable that they're not requiring testing for people flying into the U.S., so it seems pretty easy for someone to fly there and fly in. Isn't that just a massive hole in the protection, or how do you work around that? Would you like to see testing for people who are coming in from the U.S. as well? Do you think that's coming?
Yeah, I suspect, I don't know the details. As the minister indicated, we have a meeting following this to understand more about what the intent is. But I will also say that we are still requiring pre-arrival testing. So that is still in place, even from the U.S., with the exception of people driving across the border for very short intervals. So I think that's important. We know that the pre-arrival testing from the U.S. is very reliable, and that's one of the reasons, perhaps, why the U.S. was not considered, and also that we have a lot of travel across these borders. So I know that this will be under some discussion in the next little while, and I don't have all the details right now.
Our next question is from Moira Wyton, Tyee.
Hi there, thank you. Moira Whiten from the Tyee. My question for Dr. Henry, we saw the Delta variant really drive the third wave and the fourth in the fall. What is being done to make sure BC doesn't repeat the other variant-driven waves we've seen? And, should British Columbians be kind of mentally or physically preparing to see a fifth wave and a fifth peak in the province with this new variant?
I think there's a couple of things that I tried to outline here, but the number one most important one that protects us all, that protects our healthcare system, that keeps us from getting really sick is vaccination. And the fact that we have very high rates of immunization compared to what we had even a few months ago, the fact that we now have protection for younger children is really, really important. I can't overstate how much that provides us protection, particularly from the severe illness that leads people to need hospital care or ICU care, and all of the impacts that has had on our healthcare system and that we're seeing in other places. That is still our number one best tool to get us through this. So the booster dose program that we have, the vaccine mandates that we have, and taking that with the other moderate what am I trying to say, restrictions that we have in place with our PHO orders. So not forgetting that the public health measures that we know work will work against this variant too. So that means wearing our masks, it means cleaning our hands, it means keeping our distance, especially not having crowded indoor spaces with many other people.
Do you have a follow-up?
I do, thank you. Late in last summer, the Government of Ontario's Science Advisory Committee said that, or estimated that up to 90% of unvaccinated people in Ontario could be infected with COVID by the end of the following year if kind of current restrictions and transmission levels stayed the same. Does BC have any estimation or modeling around how many of the still hundreds of thousands of people who are unvaccinated can expect to be sick, and what the impact of that will be or would be on BC's healthcare system's ability to function?
Yeah, so that's a moving target, and I think what we can see that. We see that in children 5 to 11, and actually it's one of the reasons why it's so important to immunize that age group, for example. That is the largest age group of people that are not yet vaccinated, and we saw a rapid increase in cases. And yeah, I think we would see, we know this virus is endemic now, which means it's circulating in the community. In many communities, we can no longer contain it with some of the measures that we had early on. So it is inevitable that if it is transmitting in a community, that the vast majority of people who are not protected through vaccination will get infected. But we can reduce that risk absolutely dramatically. Even if it's not 100%, we reduce your risk of getting infected if you've been exposed by 70, 80, 90%, depending on how long it's been since you've been vaccinated. But the other thing that we know is that we reduce severe illness even more than that, because it's not just it's the other parts of our immune system that help us prevent severe disease as well. So yes, we have some modeling. You've seen some modeling that came out just this week looking at vaccination rates in communities and transmission rates in communities that came out from the Simon Fraser group. And we have not specifically said what percentage of those unvaccinated will, at least I've not seen that, because it's a moving target as immunization rates go up and as transmission moves around in different communities.
Our next question is from Belle Puri, CBC.
Hello there. Of course, we need our answers, please, in English and French. Dr. Henry, so people in communities in BC's north who want to get their children vaccinated are concerned about the lack of appointment times. In Prince George, it seems there are only 6 days between now and Christmas when children vaccination clinics are being held. Is there a plan to increase that so more people can access vaccines for their children?
Absolutely, and maybe I'll turn it over to the minister because, yes, we are planning across the province. It's been a challenge in the last few days for many reasons, but yes, there is a plan.
And I think with respect to the north, I'd say that people should know that the details of timing of vaccine arrivals, which come directly to regions from the central federal depot, were quite uncertain last week, and the vaccines in the north were late arriving, and this did and has affected the early appointments. So once the vaccines arrive in a health authority from those depots, the federal government depots, or from manufacturers, vaccine has to be unpacked, divided up, repacked, and placed on trucks for distribution far and wide to communities across the health authorities. This takes significant time and has to align with very particular cold chain requirements. It's because of that we've been doing so much work to prepare our pharmacy system, and I may talk about that briefly in a second. So it takes vaccine, for example, 6 to 8 hours to thaw before it's ready to use in clinics, and the delay in arrival makes it a challenge, especially with some of the significant weather we're seeing around the province. For that reason, Northern Health has a practice of delaying 1 to 2 days beyond the rest of the province in timing and scheduling of clinics in order to risk manage the risk of having to reschedule large numbers of residents when vaccine doesn't arrive on time. So the decision was made to defer the start of the NHA and IHA campaign to Wednesday, December 1st to ensure the availability of vaccine in every clinic. And needless to say, it's a priority in the north because we continue to see higher transmission in the north. It should be said that test positivity in the north is coming down, which is a good sign. It's still dramatically higher than the provincial average. It has come down from a 7-day rolling average of around 20% through much of October and November to about 12% as of today, which is good news. Of course, test positivity across the province is down at 3%, which is considerably below as well for the province as a whole, but the north is a priority. We've made, I think, extraordinary progress in the north with our immunization clinics for first and second doses. It's a priority, obviously, for booster doses everywhere in the province, and we're going to continue to do that. I just want to say finally that we have, and Dr. Henry referred to this, people are asking, I think, how you're going to do all this, that we have a very significant number of children. There are about 349,000 children between 5 and 11 in BC. How are you going to do that? And the booster doses and the continuing first and second doses. And part of that is the work we've been doing with the BC Pharmacy Association since August to prepare the pharmacy sector to be a major player. To date, and Dr. Henry referred to this, we have about 200 pharmacies able to offer appointments and COVID-19 vaccinations through IMS BC. By the end of next week, there'll be a further 300 added. And by early January 2022, there will be up to 1,000 pharmacies involved. So increasingly, pharmacies are going to take on the burden and the responsibility, and the extraordinary responsibility of the booster dose campaign, or a much greater share of it in the future as we focus on vaccinating children 5 to 11 in the months of December and January. I also want to say finally, 1,056,000 influenza vaccines have been administered in BC. 1,056,414 have been administered as of November 29th, and we tend to get more. It's more delayed data in that case, but that is a significant number. It's at least that. And more than 800,000 of those have been done by community pharmacy. So community pharmacy is a big part of our campaign. You're going to see that in the coming while. And the north is absolutely a priority for vaccination. You've seen this in the relentless effort to vaccinate people that's been led as well by community leaders in the north, and we're very appreciative of that. Je dirais en français que le nord demeure une grande priorité de nos efforts pour la vaccination. On a commencé 2 jours plus tard à cause de l'arrivée des vaccins au nord de la part du gouvernement fédéral, et c'est pas une question de responsabilité, c'est juste une fait. Et on va travailler fort pour assurer que des enfants dans le Nord vont avoir grande capacité d'être vaccinés. C'est important pour eux et pour tout le monde. Et en plus de cela, qu'on va continuer à ajouter à notre capacité pendant cette période, et je pense que c'est important, et le rôle des pharmacies, surtout communautaires, va jouer un rôle de plus en plus important, surtout pour les troisièmes doses à l'avenir.
Val, do you have a follow-up?
Yes, please. Dr. Henry, you're messaging around avoiding crowded spaces. I'm feeling a bit confused. I'm assuming others might be as well. I mean, you're still able to, don't be in a crowded space, but you're still able to attend a sporting event or a concert. Do we know enough about this new variant to know that being fully vaccinated in those types of situations is enough to protect us? And in English and French, please.
Sure. We know that with the Delta variant, which this is very similar to, and we don't yet know the increased transmissibility. We don't yet know all of these other things about the Omicron. And yes, we do know that you can go into these, that if you're fully vaccinated, we mitigate the risk. And yes, we know that seated events, and that's one of the reasons why we have some other measures in place. Seated events, mask wearing in those environments mitigates the risk of transmission of this virus. And the other important things that I've been going on and on about for a long time now is staying away from others if you're sick, not going if you're not feeling well, making sure that you do keep your mask on when you're moving about and when you're around things, or if you're not eating or drinking. And these are all important things that will help us get through this period of time, but we have to find that balance. We can't stop all those important things, whether it's arts or music or sports or school or going to work. We need to find ways to do these, going to school, going to university, to do them in the best way that we can, mitigating the risk the best ways that we can. And we've done that pretty well here in BC. We're not seeing major outbreaks related to sporting events or concerts. And I had the slightly terrifying but wonderful experience of going to a live music event. And, it was sit down indoors. There was a limited number of people, but it was fantastic, and it's important for us to be able to do those things. You don't realize how much of your emotional and mental health is involved with being able to have shared experiences of music or art or sports with others. So we are trying to find that balance. It is a challenge right now when there's still a lot of uncertainty, and we're going to be watching very carefully, particularly over the next few weeks. And as I said, we're doing enhanced surveillance, we're monitoring the travel, we're working with colleagues around the world to understand the impact of this new variant. But at the same time, we're trying to live through this pandemic here in BC.
Oui, on sait bien que on limite les risques de COVID-19 quand on est vacciné. C'est bien évident quand on voit les gens, le fait qu'on est 50 fois plus possible d'être à l'hôpital si on n'est pas vacciné. Donc c'est évident, bien entendu, et ça va continuer à être le cas aussi. Quand on est assis, on est beaucoup moins vulnérable. Donc, dans ces conditions, dans une audience à 100% vaccinée, et en même temps, quand on est ici, on n'est pas en train d'aller ici ou là, comme on peut, ça se peut quand on est en soit début. Je pense que ça fait une grande différence. Et donc, il va continuer à être important d'analyser l'évidence, mais cela étant, ces mesures sont les mesures nécessaires. C'était le cas au commencement de la pandémie et c'est le cas maintenant. De laver des mains, bien entendu, d'être vacciné, bien entendu, de porter un masque, bien entendu, et d'autres mesures qui peuvent limiter votre risque alors qu'on continue à participer à des activités très importantes dans la société.
That's all the time we have for today. This concludes today's event. Thank you, everyone, for joining.